DJM TV.
Resident doctors go on strike as the president of Nigeria jets out of the country to seek medical attention. Hi guys, good morning, good afternoon, good evening, depending on the time this video got to you. Trust you've been doing good. Welcome to a brand new month of April. This is DJM TV Daily News Update, your one-stop channel for everything news in Nigeria and all around the world. Now to the news. The National Association of Resident Doctors of Nigeria, NAD, has commenced their nationwide indefinite strike. And this has paralyzed medical services at public hospitals all over Nigeria, leaving hundreds of patients unattended to in government-owned hospitals. Those who are buoyant enough now resort to the private hospitals. The National Association of Resident Doctors of Nigeria gave the federal government of Nigeria an ultimatum in March 2021 to improve the wages and allowance of doctors to avert the indefinite strike. Although the federal government of Nigeria said the major nationwide strike would be averted after the memorandum of action with the National Association of Resident Doctors is signed. The Minister for Labour and Employment, Chris Ngige, actually said on the 31st of March that a memorandum of action has been signed and the government has gone into full discussion with the resident doctors, and the discussion was fruitful, and as such, the strike will no longer hold, as they had promised to implement all the things that were agreed upon in the memorandum of action. Speaking at the meeting, the Minister for Labour and Employment said hopefully by the 1st of April, all the experience with the non-payment of salary will be a thing of the past, as the payment that was agreed upon on the second categories of doctors would be an overflow of the quota of the Medical and Dental Association. He also added that by the time the chief of the medical director CMDs come up with a final list and harmonizes it with that of the Medical and Dental Council of Nigeria, that the government will be able to make payments, as there will not be any more issues with the payment of the salaries of doctors. The president of the National Association of Resident Doctors, Dr. Uyi Lawa, said that they were tired of the memorandum of action that the government always signs with them but makes no plan on implementing it, and they promised that they will go on strike despite the MOA that was signed with the federal government. After the closed-door meeting, which lasted for over 7 hours with the Senate Committee on Health led by Senator Yahaya Ahmed, Dr. Uyi Lawa, who is the president of NAD, promised that he was going to take back the decision to the members of the association to know if they were ready to accept whatever was written in the memorandum of action, and if it was enough for them to suspend the strike. But as at the 31st of March midnight, he said they could not call off or suspend the strike until they begin to see the implementation of the agreement which was reached with the federal government. The doctor said that they were tired of signing the MOU, that what they want is implementation and not just mere signing. He also said that resident doctors suffer so much in the country and they have lost up to 17 of their members due to the COVID-19 pandemic. Some of the demands of the National Association of Resident Doctors of Nigeria include the payment of salaries to all house officers, regardless of the quota system. They also talked about the upward review of the current hazard allowance up to 50% of their consolidated basic salaries of all health workers, and the payment of the outstanding COVID-19 inducement allowance, especially for state-owned tertiary institutions, and the payment of death in service insurance allowance to all health workers who passed on due to the COVID-19 and were in active service. During the meeting held on the 31st of March 2021, the federal government pleaded with the resident doctors to consider the plight of the citizens of Nigeria in need of health care. The resident doctors had also threatened that they were going to withdraw their services if the government had failed to meet their demands. While speaking at the meeting, Senator Chris Ngige pleaded with the doctors not to embark on the strike, saying that the government knew that the country was in a bad place due to the impact of the COVID-19 pandemic on the health sector. He said the majority of the welfare issue, which was under contention, were almost resolved even before the letter of complaint and notification of planned strike was sent to the ministry. He had told them that he had held informal meetings with the finance ministry, and they've told him that they're going to start resolving some of the problems. The two committees in the National Assembly has also tried to get across to the resident doctors, he said, and they were going to intervene to ensure industrial peace in the health sector. He spoke to the conscience of the doctors, appealing to them that the country was in a very bad period health-wise and the world all over, and Nigeria is not an exception. So he said that because of the general public, that the doctors should reconsider their stand on the strike issues. But the NAD has said they were going to go on strike because they were tired of the agreements that were being signed and no action being implemented. The nationwide indefinite and total strike of the National Association of Resident Doctors of Nigeria started at 8 a.m. on the 1st of April 2021. And this led to so many difficulties in the government-owned hospitals, as many patients were seen loitering the environment, saying that the doctors, even on ground, had refused to attend to their medical emergencies. A patient at the Lagos University Teaching Hospital, LUTH, said he was supposed to undergo a series of tests but could not be attended to, and he said he was afraid that his condition could worsen with the strike. The strike action of the National Association of Resident Doctors is coming few hours after the President of Nigeria left the shores of the country to the United Kingdom to seek medical attention. President Muhammadu Buhari, who had condemned the past administration of always leaving the country's health sectors unattended to and seeking medical attention outside the country, has traveled more than 5 times on what we call medical tourism. Many Nigerians have come out to condemn the visit of Buhari to the UK for medical checkup. Meanwhile, the president of the Association of Resident Doctors, UCH chapter, Dr. Temitope Hussein, has said that they have commenced their strike on the 1st of April 2021, and it's a total indefinite strike. He said, "We hope that the government will listen to our demands so that we can call off the strike. First of all, our number one demand is for our members to be paid." Speaking, he said, for the house doctors in UCH, 373 of their members have not been paid their salaries. Also, house officers have not been paid for the past 3 months. That was why the strike was embarked on. He said other cadres of doctors, resident doctors and medical officers, a total of 233 of them, have not been paid their salaries from January up until March. Speaking, he also said, "Our demands are very simple and they are understandable because of the nature of the work we do." He said it is not fair when a doctor needs to see patients and has not been paid salary for 3 months. He said the worst thing is that we all know about the ongoing brain drain. We have new fresh doctors coming in that have just been given their first employment and they've not been paid salaries for the first 3 months of them getting employed as doctors. This is not good for them. He said the very next option for them would be to leave the country to seek greener pasture. That might be the option on the table for them. It's a very feasible option because they feel depressed about how the nation is treating them as young doctors. He also said he was happy about the high compliance level in UCH as resident doctors commences their nationwide strike. While responding to what many Nigerians said on social media concerning the strike of the resident doctors as being insensitive, the president of the National Association of Resident Doctors, Dr. Oyiwala, has come out to respond on behalf of its association, saying, "Nigerians must understand that we love them and the strike is not intended to hurt them, but to challenge the Nigerian government at M. Buhari, at FM OH Nigeria at Labour Min NG, whose responsibility, amongst others, is to care for our citizens and labour force to do the needful. He also said, I want Nigerians to ask the government to be more responsible, and there is nothing that can make us avert this strike. This is where we'll come to the end of this edition of DJM TV Daily News Update. Do not forget to drop your comment in the comment section, like and share this video. And please, if you have not subscribed, do well to subscribe. Turn on the notification bell so that you'll be one of the first persons to know whenever there's an update on this story or a brand new story. Do not forget to follow us on Facebook, on Instagram, on Twitter, and on TikTok. Also check out our website at www.djmtv.news. Do not also forget that you can place your advert with us at DJM TV and be rest assured that your advert will get to the desired market. Until we come your way again with another edition of DJM TV Daily News Update, I remain Lawuru Favor.
DJM TV. DJM TV.
People are people don't say no, they don't like it.
Welcome to DJM TV.
DJM TV. DJM TV. DJM TV. DJM TV.
Some of the delegates and ask their questions.
DJM TV. DJM TV. DJM TV.